Welcome to free webinar 5.0. So monthly, twice or thrice, we are providing a free webinar. So the main reason is to introduce myself, whatever I am doing, I want to introduce to you. At the same time, I want to deliver a quality content without getting any fee. Okay, that is my self-satisfaction I'm doing as a physiotherapist. So I welcome you all for this webinar 5.0. Today, what we are going to see is functional way of anatomy and biomechanics of the core muscle. So let's decode it. Yeah, before going to do that, so I want to introduce myself. So I'm Dr. Sharath, sports physiotherapist. I'm from Good Physio Community. So I started this community to find the good physio within us. Okay, everybody, all of us are good physio, but the thing is, we are not finding that. Okay, so I started to find myself, and that's where I am here now. So I want everybody need to do that process and get your best version in the physiotherapy. That's it. Dr. Aishwarya, what you are doing in the screen? Yeah. So this is all about myself. I already introduced, so I don't want to do that again. So what is the vision of our community is to help. I already told that. The second point is like I want to give you the high quality content by my webinar or seminar or whatever the workshop or in future I'm going to do. So everything, that is the first thing. Sharing, caring, growing together is our mantra of success. So whatever we know, we need to share to others, and whatever the support after this webinar also, if you are there in the group in your career, if you want any support in kind of a knowledge wise or else any other personal wise, job wise, we will be here to care each other, okay, and grow each other. That's it. So this is the instructions I want to let you know. So kindly mute your phone, thereby it won't disturb others. Okay. Any questions you can ask me by unmuting and directly through the audio. So or else you can raise your hand because I can't able to read the chat box every time. Whenever I ask any question, that time I will be open the chat box. That time you can uh, throw your questions into the chat box. So who are all going to connect with me till the end of the sessions, I'm going to give you the pre-recording video for the anatomy, biomechanics of the and pathomechanics of the plantar fascia video, and also some discounts in the uh, upcoming webinar and also for my membership program. That's it. So stay connected with me. I will go very slowly. Each and every point, I will have a check post. I will ask you, is there any doubt or not? So feel free to uh, speak with me. So whatever the doubt, if you are not understanding the English language, I can able to deliver the content in Tamil as well as Telugu as of now. Okay. So rest of the languages, just I can't do that, but still I can able to do whatever the better way of understanding. I can make you to do that. Yeah. So what is the objective of the webinar today? First, to know what is the core actually. What are all the core muscles? So we are having a lot of doubt in that. And how the muscles work. How the muscles work individually as well as how these muscles work together with other muscles. Then what are all the facial systems, okay, whichever crossing the core and what is the main function of it, okay. And also what are the functional activity of us which is demanding the core stability. So these are all the things we are going to see today. Yeah, so the syllabus is what we are going to do now: anatomy, biomechanics of the core muscles, whatever is there, it's like a free and paid. If you want to attend in more depth detail, I will give you the content of how to assess the kinetic chain and how to assess the kinetic leak. Okay, in that, how to find it, and evidence-based protocol to activate those leaked muscle, weak muscle, and I will let you know the evidence-based protocol to stabilize the core as well as to gain the endurance as well as the functional strength. Okay, thereby you can make your clients or you can make your patients to bring back to the functional level. It's not like only reducing the pain. You can able to make them to bring back to the functional level. Okay, those are all the things I'm going to give. Let's begin. All the very best for yourself as well as for myself. Happy learning, my dear students. Yeah. So I want everybody to read this. So the core family. So first, what is meant by DCM? Deep core muscles. So these are all the main muscles of the core. Can anybody or together we can read? You can unmute and you can read the muscles. I'll be happy if you read. Yeah, anyone you can start and people will follow you. Come out. So this is the good physio. Yes, yes, good. Multifidus,
Diaphragm,
diaphragm,
pelvic floor muscles,
pelvic floor
like
muscles, including levator and coccyx.
levator
Allow
muscles,
next. Hmm.
interspinals,
Interspinals,
spinalis,
intertransversary,
inter, in, yes, sir.
intertransversary.
Uh,
Okay, so
inter, okay.
till this level, from transverse abdominis till intertransversary level, or the call it as deep core muscles. Okay, usually if you see, only 4 muscles will be showing everywhere: transverse abdominis, multifidus, diaphragm, and the pelvic floor muscles. But and also along with the multifidus muscle, you have an intraspinalis muscle and you have a intertransversal muscle. So keep in that in remember. Okay. Now ICM means intermediate core muscles. What are all the intermediate core muscles? Internal oblique, quadratus lumborum, erector spinae. In that there are 3 groups: iliocostalis, longissimus, and also a spinalis group. Then semispinalis. Okay. Rectus these are all the intermediate group muscles. Okay. And if you take a superficial core muscles, so these are all the rectus abdominis, external oblique, latissimus dorsi. Okay. So these are all the superficial core muscles. And like these are all the pelvic hip muscles, pelvic and hip muscles. So these muscles are indirectly and also like a supporting muscle for the core. So what are all those muscles? Psoas major, gluteus maximus, medius, and minimus muscles. So these are all collectively call it as the core family. So you should know what all the muscles are there in the core. If somebody asks you what all the muscles there in the core, you should not tell directly gluteus maximus or gluteus medius. You should tell like this: start with always deep core muscle, then go ahead with the intermediate core muscle, then superficial core muscle, then come with the pelvo hip muscles. Okay, everybody got the clear idea in the core family? Is there any doubt? If you are clear, you can type CC in the chat box. Okay, right. CC means crystal clear. Yeah, we'll go to the next slide. Now, what makes up the functional core? Okay, what is meant by functional core? So, functional core means this is the 360-degree unit. 360 in the sense it is not only like this, it is like this also and like this also. So wherever you make it a round, okay, the core muscles will be there. The core muscles together, it is having a cylindrical in the shape. Okay, cylindrical in the shape. So there are some muscles which is forming a roof, base, front, and back side, everything. So the roof is formed by the diaphragm muscle, and the base is formed by the pelvic floor muscle. Front and sideways is formed by the transverse abdominis muscle, and the back, the near to the spine, okay, it is formed by the multifidus and also the intertransversi and interspinalis muscle. And if you take a bridge, that is formed by gluteus and psoas major muscles. So here gluteus muscle is there, but it is not like exactly on the spine, right? It is from the pelvic only, it's starting itself. So it is like a bridging muscle, you can tell, rather than the back muscles. Yeah. So what is the main thing these muscles are doing? These muscles act, okay, together with other muscles, in the sense diaphragm will act with the pelvic floor, act with the TA muscle, act with the multifidus muscle, all together act as a co-contract and stabilize the spine and the pelvis. I will let you know how it is doing. Okay. Okay. So what is the main thing these muscles are doing? These muscles act, okay, together with other muscles, in the sense diaphragm will act with the pelvic floor, act with the multifidus muscle, all together act as a co-contract and stabilize the spine and the pelvis. I will let you know how it is doing. Okay. Okay. So what is the main thing these muscles are doing? These muscles act, okay, together with other muscles, in the sense diaphragm will act with the pelvic floor, act with the multifidus muscle, all together act as a co-contract and stabilize the spine and the pelvis. I will let you know how it is doing. Okay. First, we'll see one by one these muscles. Followed by that, I will let you know how it is stabilizing the spine. Right now, so first we've seen what all the muscles and what all the muscle is forming: roof, base, front and sides, and the back. Now first the roof. So this muscle, the diaphragm muscle, is primarily meant for inspiratory muscle part. This is an inspiratory muscle. If the muscle is, if you breathe in, okay, what exactly you are doing is, you are doing as a syringe. Okay, this is a syringe. If you think, like, for example, okay, this is a syringe. If you pull the syringe like this, okay, in the syringe you will have a black color rubber, right? That is called it as diaphragm. If you pull the diaphragm downward, what will happen? There is a empty space will be created in the syringe. Thereby, whatever the medicine you are pulling, it will come into the syringe. Likewise, you are creating an empty space inside the alveoli by means of pulling the diaphragm downwards. Okay, by means of what is happening, airflow from the atmospheric pressure, it is going inside the lungs. Thereby, you are breathing. That is the main function of the diaphragm, which is doing. Okay, that is the main function. It is doing that function, and also what it is doing, it is sealing. Okay, it is sealing the abdominal cavity from the upper side. So abdominal cavity is like having a abdominal organs. Okay, abdominal organs, and also whatever the abdominal organs which is present inside, it is creating some pressure. That means if you if somebody, like, in accident, if you see, or else any murder or something like bigger type of murder, if any small gap is there in the core, what will happen? The intestine will come out. Okay, whatever the abdominal content will come out. You can see, right? Some dogs and all. So a lot of things will come out with pressurized. So that is because of what? So before the accident or before that incident is going to happen, those organs are protected by means of layers of the muscles and layers of the facial system. Okay, so that means something, a pressure which is created inside because of those content. What is the pressure is called it as? Inside the abdomen there is a pressure, right? What is that pressure? Can anybody? What is meant by IAP? Indian Association of Physiotherapy. Yeah? It is there here only. Anybody? Yes, perfect. Intra-abdominal pressure. Yes. So intra-abdominal pressure means it is like a water balloon. You need to remember that. Water balloon. So if you take the water balloon in your hand, okay, from which side if you press from upper side, the water balloon, the water will go in downward. If you press from sidewards, it will come upward and downward. This is Mr. Aditya, can you mute your phone? Yeah. So if you press the water balloon sidewards, it will go up and down. Okay. If you press water balloon from upside down, it will come side to side and front and back. So likewise only the intra-abdominal pressure also will be. Okay. If you compress the abdomen in any direction, it will go to opposite direction. Okay. Wherever the gap is there, it will try to move. So you need to remember that your thoracic cavity is a air-filled balloon and your abdominal cavity is like a water-filled balloon. That's it. Okay. Now, coordinates with pelvic floor and transverse abdominis. That means what? Okay, what it is coordinating? That means whenever you do the inspiration, okay, what you are doing, you are descending the diaphragm muscle. That means there is some space in the abdomen. Okay, there is some space in the abdomen. That space is getting reduced by means of the diaphragm. Okay, what is happening actually? Whenever you are inhaling, already there is a small space only in the abdomen, but when you are inhaling, again it is going to very less. That means whenever you do inspiration, your abdomen will come out. If you do proper inspiration, if you do diaphragmatic inspiration, your abdomen will try to come out. Why it is trying to come out? Because there is a less space in the abdomen by means of the descending of the diaphragm muscle. So because of that, what is the good thing actually? So good thing in the sense there is more pressure only, but the thing is your other muscles, that is your transverse abdominis muscle, your pelvic floor muscles will need to contract with the diaphragm muscle. Okay, if it contracts with the diaphragm muscle, what will happen? You are already with the diaphragm muscle, you are creating a pressure from the upside towards downside. And if you co-contract your pelvic floor muscle, it will come from downside to upside. And if you co-contract your transverse abdominis muscle from the front side and the sideways, it try to strengthen. Okay, all together the load where it will go to? Okay, where it will go to? Towards which side? Can anybody say? Front you are compressing, down you are compressing. Okay, upside you are compressing, downside you are compressing, front and sides you are compressing. The load where it will go? Where the load will go now? Which direction it will go? You are compressing all the side except only one side. Which side you are not doing? Front, sorry, upward, downward, okay, front and sides you are compressing. Anybody have any doubt? Diaphragm muscle மேல இருந்து கீழே இறங்குதாப்பா. இறங்கும் போது உங்களுக்கு மேல இருந்து கீழே புஷ் ஆகுதா? pelvic floor muscle என்ன பண்ணுது? டைட் பண்ணும்போது கீழே இருந்து மேலே போகுதா? transverse abdominis muscle டைட் ஆகும்போது என்ன ஆகுது? உங்களுக்கு வந்து சைட்ல இருந்து முன்னாடி இருந்து உங்களுக்கு வந்து ஷ்ரிங்க் ஆகுது. கண்ட்ராக்ட் ஆகும்போது டைட் ஆகும்போது என்ன ஆகுது? நம்ம வந்து வயிற்று உள்ள இழுக்கிறோம் இல்லையா? அது transverse abdominis muscle உடைய உதவியால் தான் நம்ம இழுக்கிறோம். So with the help of the transverse abdominis only, we are drawing the abdomen inside. Okay, so all the pressures from the front, side, down, up is all together where the abdominal intra-abdominal pressure is going now. That is my question. Where it is
Backward.
taking? That's it. Posterior. Somebody, yes. So try to speak with me because I'm not seeing the chat. Okay, right. That is the backward. Now, okay, keep it in your mind. Okay, we will discuss it in further. Some people won't have a diaphragmatic or activation itself. If you tell them to inspire, what will happen? Instead of bulging out of your abdomen, it will go inside. That means they are, instead of using the diaphragm muscle, they are more using the secondary inspiratory muscle. That is your intercostal muscles and also your scalenus, serratus anterior. Okay, those are all the muscles they are using. You need to correct that. Yeah. Now go to the transabdominal muscle. Okay, it is like a shield. It is covering like from as a corset. Do you know lumbar corset? Okay, if you wear the corset, how it will pull? The elasticity of the corset will compress the each and every part of the abdomen, right? Like that, if the transverse abdominis muscle contracts, it will happen the same. Okay, so that is the main function of the transverse abdominis muscle. It is a natural corset. So what is meant by feed forward mechanism? Can anybody let me know what is meant by feed forward mechanism? What is meant by feed forward mechanism? Yes or no? Okay. Somebody chatted. Posterior. Very much fast. Oh, feed forward mechanism means it is a feedback, okay, but that feedback is sensed before you are going to do any activity, and it is giving you the protection by means of some action. Thereby, the activity is going to be done properly, appropriately, or else coordinatively. Understood? Feed forward means now I am going to stand from sitting. Okay. If I am going to stand from sitting, my head position will change, right? So before I am thinking that I am going to stand, okay, not before I am going to thinking, before I am going to implementing that action in my legs, my neck stabilizers will get activated and it won't allow my head to fall forward. That is called feed forward mechanism. Whenever you do any action in the trunk, okay, any forward bend or twisting activity, okay, side to side bending activity, whatever you do by means of your trunk, before going to do that activity, that transverse abdominis muscle will get activated and it will stabilize the spine. So that is call it as feed forward mechanism. Okay, it compresses the abdomen, thereby it stabilizes the spine. I will let you know how it stabilizes the spine. Only that doubt you have till now. Usually lower back pain, chronic lower back pain, as per the evidence, they are having a atrophy, decrease in the size of the transabdominis muscle. They found through the research. கை கால் சும்மா இருக்க மாட்டாங்க பசங்க. போயிடுச்சா? தம்பி யார் அது? இருக்காதீங்க, சின்ன குழந்தைங்க மாதிரி பண்ணாதீங்க. நீங்க என்ன பண்றீங்களோ உங்க ஸ்கிரீன்ல எல்லா ஸ்கிரீன்லயும் தெரியும் அது. Okay, so till now everybody clear? If you clear, you just type C in the chat box. The activation of muscles before actual movement, like preparation for the movement. Dr. Sukata Malkar. Very good, actually. Exact answer. Exact answer. Yes. Perfect. Now, thank you so much for your feedback. Now we'll go to the next slide. So that is the multifidus muscle. What is the main function of the multifidus muscle? It is like a segment guard. What is meant by segment guard? You'll have some, anybody? Any answer in segment guard? What is meant by segment guard? Spinal segment guard. So I give you some example, okay? What you're doing, you are taking a small boxes, rectangular or square type boxes, okay, together. You are making it like one box, one more box, one more box, one more box, one more box, okay? You keep it on your hand. If you move your hand like this, what will happen to the box? It will collapse, right? It will collapse. If you move a little bit faster, it will collapse easily. Now what you are doing, you are taking one long thread, okay? You are taking a long thread and you are tying from your last box that is placed on your hand to the first box. Only one thread, you are tying everything together with that one thread. You are making it tight, okay? If you do that, what will happen to the boxes? Can anybody say? If you do that, will it get stable or not? Become more stable, Dr. Navisha. Yes. So you can tell it will become more stable, but I will give you the exact answer. So whatever you are in your thought process, it came, which was exactly correct. But that is the thing which is done by the erector spinae muscle. One rod connecting a 3 boxes, one rod connecting a 4 boxes, one rod connecting a 6 boxes, which is done by the erector spinae muscle. Then what is the main function of the multifidus muscle? It connects vertebra to vertebra, okay? Maintains the segmental spinal stability. So I will let you know that. Where is that slide? Yes, this is the slide. Okay, see here. Dr. Nabisha, you told it will get more like it will get more stable, right? That is the function by means of a global muscle stabilizer. You can see here in the left side. That is the function which is done by the erector spinae muscle. But if there is no local muscle like a multifidus, okay, no local stabilizer is not there, whatever we tie, if we do any movement, for example, if you are tying with both sides equal tension, it will be stable. But if we are going to do a side flexion, a rotation, a forward flexion, what will happen? Only one side muscle only will activate, right? One more side will get relax. In that kind of scenario, what will happen? For example, see here it is getting activated, here it is getting relaxed. What will happen? It will collapse to the relaxed side. It should not happen, right? To prevent it, the muscles are the local stabilizing muscles. This will act as a feed forward mechanism before the erector spinae is going to fire. Now everybody got the point? If everybody got clear, you can type C in the chat box. became more stable, connects to vertebra, it will not collapse, it will be. Yes, very good, very good. Clear answers. Good. Yeah. So till now, so far, we finished diaphragm muscle, transabdominis muscle, multifidus muscle. Okay. And now we are going to see the pelvic floor muscle. Why this muscle came? Posterior pars, right? Yeah, we'll finish this, then we'll go to the other muscles. The core's bottom support. Okay, it is not like a small role, it is like a biggest role because you are giving lot of pressure from the already you are giving a pressure from the diaphragm muscle and you are giving pressure from the abdomen muscle. So each and every pressure along with the gravity. Gravity is one more pressure, right? Whatever the abdominal content is there, it try to descend down. Whenever we stand, whenever we walk, whenever we sit also, it try to descend. If the bottom is not strong, what will happen? Everything will sag down. Okay. So that is the main thing which is done by the pelvic floor muscle. So in general, what is the main function of the pelvic floor muscle? The pelvic floor muscle is having a central tendon that is known as perineal body. Okay. We all have a perineal body. That means there is a line between our two legs. You can able to see there is a line. So that line, that is a tendon actually. If you go and palpate that line, that is a tendon. Okay. That central tendon, it connects the two sides of the muscles. Two sides of the muscle. That is a central tendon which connects these two sides of the muscle. And those muscles, okay, this is the tendon and this is the right side muscle. Just imagine, and here the bones, pubis, okay, your ilium, your ischium, okay, and your coccyx. The muscles will start from the bone and it will pull the tendon towards right side. Now everything goes towards the right side like that. In the left side also the muscles is pulling towards the left side. Right side, left side. Together what will happen? Now you can able to imagine that. You can. So this is the, okay, this is the pelvic floor muscle. Okay, usually it is like this. If I am not contracting, the pelvic floor is like this. Okay, this is right side pelvic floor, this is left side pelvic floor, and this is the central portion. The central portion is this one. Okay, so you can. So you can imagine this box is a pelvic floor. This box is a pelvic floor. This right side is right side pelvic floor muscle. This is left side pelvic floor muscle. Now I am contracting the both muscles. Okay. So thereby what is happening to the pelvic floor? It is lifting up, right? It is lifting up. So this is the main thing which is happening in the by means of the contraction of the pelvic floor. Everybody got that point? Is there any doubt how it is lifting the pelvic floor by means of contraction? From the right side, from the bone to the central tendon, left side from the bone to the central tendon. Now both muscles are contracting, thereby the perineal body is actually lifting. Okay, thereby you sit and do the pelvic floor contraction. You can feel that, see, your height is increasing. You can able to feel that your height is getting increased. So that is the main function of the pelvic floor muscle. It coordinatedly co-contract with the other core muscles, thereby it is helping in maintaining the intra-abdominal pressure. If your pelvic floor muscle is weak, you may have if you are a female, you may have a uterus prolapse. Okay, if both gender, you may have a urinary incontinence. Okay, erectile dysfunction in the male. So these are all the functional dysfunctions will happen because of the poor core control. That's it. Okay, poor pelvic floor control. I will let you know each and everything in detail. Don't worry. So these are all some idea. Now, my dear students, see here. There is a muscle called levator ani in the pelvic floor muscle, which consists of three muscle groups. Okay, one is puborectalis, second is pubococcygeus, and one more is iliococcygeus. These three muscles collectively known as levator ani. Keep in remember. Okay, now come here. This is anterior and this is posterior. Whatever you are seeing the view, what is this view? Can anybody able to tell? I'm seeing your chat box. What is that view? Anterior, posterior, superior, inferior. What is the view? Can anybody imagine? transverse view, inferior, superior, superior. So the both who told superior, exactly the answer is correct. Actually, what you are doing, you are seeing the pelvic floor from the upper side. Okay, you are seeing from the upper side. You are looking down to the pelvic floor. You are not seeing from the downside. You are seeing from the upper side. That means you are seeing the inlet of the pelvis here. I removed all the organs here. I removed all the organs here. Thereby, you are seeing only the bottom. Okay. So now you imagine. So this is like a female pelvic floor. So that's why there is the urethral hiatus, vaginal colon and also is there, and rectal hiatus is there. Now you see this puborectalis muscle. Usually it is coming from the pubis and it is crossing over the rectum, and it is going like this. Okay. The main function of this muscle is to maintain the anorectal angle. If you see your rectum, our rectum will be like this, right? In the left side, we'll have the descending colon. From there, sigmoid colon. From there, there is a rectum, and from there, anus will be like this. Rectum will be like this, anus will be like this. So 90-degree angle will be there. So this muscle is the main muscle which maintaining that recto-anal angle. Okay, if that muscle is not that, what will happen? That angle won't maintain, then we won't get fecal continence. We'll get fecal incontinence. And whatever the pre-rectal fibers of the puborectalis muscle, it is helping in the urethral and vaginal contraction. Thereby, it can able to help in the continence. Continence in the sense urinal continence. And pubococcygeus. Pubococcygeus, especially, it is helping like a supporting in the pelvic floor muscles. Thereby, it is helping the organs to stay there, especially your uterus. Okay, it will help to stay there. And it also having the attachment in the coccyx, so it can able to produce some minimal movement in the coccyx also. Iliococcygeus and coccygeus muscle. So these muscle, iliococcygeus also is the part of the levator ani, and iliococcygeus, pubococcygeus, puborectalis. Instead of this closing function, it also work as a support for the pelvic organs. That's support in the sense it provides the base for the pelvic organs to sit there, and it will prevent the organs to sag down. That's it. And the coccygeus is otherwise known as ischiococcygeus. Okay, so that muscle also is like a coccygeus group. The main function of the coccygeus muscles also to support the pelvic organs. That's it. So these are all the functions of the pelvic floor muscles. Is there any doubt? Is there any doubt till now so far? Clear. Only one person is here actually out of 39 members. Okay, thank you so much for the upcoming answers. Yeah, நீங்க பாருங்கப்பா, உங்களுக்கு ఇతనా పురియల, எனக்கு வந்து ఇంగ్లీష్లో కష్టమా ఇருக்கு, నా ఇంగ్లీష్ పేసறது పురియల, లేకపోతే నేను మాట్లాడుతున్నది మీకు అర్థం అవ్వట్లేదు, ఇంగ్లీష్లో కష్టంగా ఉంది అంటే నాకు చెప్పండి, எனக்கு சொல்லுங்க. சரியா, వాయి திறந்து பேசுங்க సార్, ஒரு వాటి తమిళ్లో சொல்றங்க సార్, இல்லைనా సార్ ఒకసారి నాకు తెలుగులో ఎక్స్ప్లెయిన్ చేయండి సార్ అని నేను చెప్తాను, ఏం లేదు దానిలో. సో బై గాడ్ గ్రేస్ ఐ లెర్న్ తెలుగు ఆల్సో, ఓకే, ఇన్స్టెడ్ ఆఫ్ మై మదర్ టంగ్. సో ఐ కెన్ ఏబుల్ టు ఎక్స్ప్లెయిన్. In future, I can learn the Hindi and Kannada also. I can do that. Okay. So because of the language barrier, we should not have a misunderstanding in the content. That is the main thing. Okay. Yeah. I hope everybody got clear. I hope there is no question. Wait. Let me remove this. Yes. Now, so I want you just introduce. So I just want you to introduce that we are having a membership program that is for the 6 months. So in that you will get a high quality webinars of the 12 webinars and also a 15 free webinars. Okay, and that recording will be lifetime access. Okay, so we are going to start from 15th of the August. So start with the cervical radiculopathy. We have the topics of each and everything. Okay, here you can able to see there is a core whatever I told you, right? So I will teach you in depth of the assessment and also the evidence-based treatment program, including Pilates principles, okay, functional training, cross training, everything we are going into in depth. So likewise, lateral epicondylitis, sacroiliac joint dysfunction, okay, kinetic chain dysfunctions in the lower limb. So we are only treating ACL means only the knee joint, ankle sprain means only the ankle joint. We are not focusing on the kinetic chain of the lower limb. So we are going to in depth in detail of those things also. So ankle sprain, chronic ankle sprains, why we are not getting the proper treatment and proper result. Okay, so those technique and ACL rehabilitation, modern posture correction. Okay, it is not like a posture you need to do with something. It is like everything together, how the posture correction came into the picture. Okay, as of now, whether it is like reliable or else it is like a myth, and what all the myth busting scientific evidence behind the postural correction, TFCC injury, wrist related things. Okay, knee osteoarthritis. Lot of people are having osteoarthritis. Lot of us, we are treating the osteoarthritis, but we don't know what is the cartilage, what is mean by the cartilage, what is the cartilage health, and how we can preserve it, how we can do the load management. Okay, what are all the strengthening progression criteria, where we need to strengthen, where we should not strengthen. Okay, where we need to go ahead with the endurance activity instead of the strengthening activity. There are a lot of things are there. So we are going to discuss in depth, and there is a principles of the exercise prescription. That means we are all giving a lot of exercise for the patient, but we don't know the principles behind the exercise prescription. So I want to take a separate webinar of like what is mean by exercise prescription, what are the principles, what are all the principles for different types of exercise prescription, like for the strength training, endurance training, plyometric kind of training, or mobility kind of training, where we need to give a which kind of sets, which kind of repetition, everything, volume of the training we used to call it as. Okay, everything in detail. So likewise, so shoulder. Okay, so till this we are having. So this is like for the next 6-month program. So if you are interested, I will share you the link. You can register through that. I will let you know the price in future. Yes, now come again to the webinar. Thank you for your valuable time, which you gave me to read that. Yes. Now I told you already, right? Pubococcygeus, puborectalis, iliococcygeus are levatoranic group. The main function is lift the pelvic floor, okay, together, and also assist in organ support, okay, and also fecal continence, not incontinence, fecal continence and urinal continence, okay, and also, yeah, core stability also it is helping. Core stability in the sense what? Maintaining the intra-abdominal pressure. That's it. Coccygeus, ischio-coccygeus also same together. What is mean by deep transverse perineal muscle, superficial transverse perineal muscle? Those muscles are the superficial muscles. Okay, whatever you seen in the image, you seen from the upper side, right? Upper view, right? So that's why you couldn't able to see these two muscles. It will be there in the downward side. So this is usually called it as urogenital diaphragm. Okay, that is the last muscle, diaphragm, which is holding other muscles also. For example, if your deep transverse perineal muscle is good, it can able to stabilize, it can able to help the puborectalis muscle, pubococcygeus muscle to function well. Okay, it is like a supporter muscle, extra layer. Bulbosponges, bulbocavernous, it is like a wall of the vagina, bulbocavernous, and walls of the penis, that is the bulbosponges muscle, helps in the vaginal contraction and the penile erection. That's it. Ischio-cavernous, anal sphincter, external urethral sphincter, okay, controls the urinal continence and the fecal continence. That's it. Okay, everything done. Now, what is the trunk stability versus pelvic stability? What is meant by trunk stability and what is meant by pelvic stability? So a small discussion. Trunk stability in the sense maintaining the lumbar spine stability and also along with the intra-abdominal pressure maintenance. That is called trunk stability. It uses mainly the three muscles. What are the muscles? Upper side diaphragm, back side multifidus, front side transverse abdominis. But pelvic stability in the sense it correlates with the SI joint, okay, hip joint, okay, and SI joint and hip joints are the main things. And inter hip joint in the sense of pubic symphysis you have, right? So these are all the joints. The muscles mainly which is focusing in the pelvic stability are gluteus, what all kind of gluteus muscles, psoas muscles, major minor, iliacus muscle, pelvic floor muscles. And this and both help in breathing, lifting, okay. But trunk stability most focusing on the lifting, twisting activity, side bending activity, forward bending activity, any lifting weight activity along with the breathing. Pelvic stability is like lower limb activity, gait activity, bridging activity, balance activity, single leg activity and all. It is mainly maintained by the pelvis. Okay, right. Now we'll see some myth busting discussion. What is the myth? What is the scientific truth? The person who is having a six-pack abs, strong core is equal to no. Okay, visible ab. I personally seen lot of patients who are having a very good definition in the six-pack muscle, but having a chronic low back pain. Okay, it is not like that. Your rectus abdominis muscle is strength or not. It is like your feed forward mechanism is activated or not. That is the main thing. And second thing, you must do hundreds of crunches for a strong core. Okay, crunches muscle, if you do more, what will happen? Only the superficial muscle will activate, and you are unnecessarily you are activating more psoas major muscle, that is your hip flexor muscle, which is not at all needed for the core stability. For the stability, what you need the muscle which is deeply connected with your brain. Okay, so that means the deep muscles you need to activate by means of some kind of a movement, okay, and along with the breathing control, okay, that we are going to teach in depth in the upcoming webinar. Core means only abs. You know the answer, right? Better than me, you know the answer. Now only we discussed. A strong core prevents all back pain. Not at all. If the patient is having a overloading paraspinal muscle, that is the erectospinal muscles, because of the repetitive overload, whatever the core is strong also, it may reduce the recurrence, or it may delay the occurrence, but it can't able to prevent. Okay, if your load is more repetitive, if you are giving an overload. Okay, so always load management is the key. So that means if your core is strong, you won't get back pain. It is like a myth. You will have the back pain because your core stability can help, but still pain is multifactorial. You may have some structural problem also. That also will cause. Now, planks are the best and only core exercise. A lot of people used to give only plank for the core, right? It is not like that. Plank, yeah, best exercise, it can help. But the thing is, planks are like you need to have a activation before going to do the plank. You need to learn how to activate the transverse abdominis muscle along with the multifidus muscle, along with the diaphragm and the pelvic floor muscle together, and all together put into the plank. If you are not doing that, what will happen? Again, you will end up into the back pain. Next one, core training is only for athletes. Not like that. For everybody, it's needed right now. Bracing your core all the time is good for posture. Yes, it is good for posture. Okay, you need to activate. So, but the thing is, some people used to do overdoing. Okay, overdoing in the sense they used to always draw in. That may cause us a stiffness. Okay, you should always pull your belly button in. Yeah, that is the main. That is the thing we discussed before also. It is not like you are pulling your belly button in, it is like making your core muscle stiff enough. That means whenever you are trying to pinch somebody abdomen, what they will do to protect themselves, they try to contract the abdomen, right? That is called core bracing, instead of only drawing the abdomen, belly button inside. And next one, back pain means your core is weak. It is a myth. It is, I told you already, it is there in the fourth slide, fourth point itself. Yeah, one of the reason, if the core muscle is weak, it is prone to get back pain. But the thing is, if your core is strong also, if you do overload, I told you, right, already, you may get. It's because of your load management. If you are not doing load management properly, you may end up with a back pain, even though if you have a strong core. That's it. Yeah. So before going to in depth of this video, this is a small gift for you. Is there any doubt? Is there any doubt till now so far? This is the animation video I'm going to show you. Can 3 to 4 people can give you a valuable reply through your voice? It will be useful for me. Through your voice, I want. Till now, so far. Any 3 or 4 people? One by one.
No.
How you felt about your today webinar? You can introduce your name and you can tell how you felt about our webinar. Like it is like narration of whatever we've seen. How you thought before coming to your webinar and what are the things. Nobody is there out of 30 members. Anyone? Good physiotherapists support each other, care each other, grow each other. Do you know one thing? To make this like core free webinar, okay, into this picture, I spent nearly 10 hours. 10 hours. That means last 2 weeks, daily 1 hour, 1 hour, 1 hour, 1 hour with my busy schedule. I spent like more than 10 hours actually. And today also, while I'm doing the job, I created this video. Okay, if you are interested in future also, you can stop anytime and you can give, no problem. Yeah. Let me give you the video. I'll give the voiceover. Wait, before going to that, I stop recording. I pause recording. Anybody thought about giving any valuable words for my hard work? Or else you don't want to speak? Still. தமிழ்ல கூட சொல்லுங்கப்பா, ஒன்றும் பிரச்சனை இல்லை, இங்கிலீஷில் தான் பேசணும்னு அவசியம் இல்லை. பேச மாட்டீங்க, நீ என்ன
Hello,
வேணா
sir.
கேளு.
Very
Hello.
nice, sir.
ஒரே வார்த்தையில் முடிச்சிட்டீங்களே, வெரி நைஸ்.
Very nice, sir.
சரி, நல்லா படிச்சீங்கன்னா போதும், கற்றுக்கிட்டீங்கன்னா ஓகே. இஸ் there any doubt till now so far?
No, sir.
No doubt. So this is our transparent fee structure bar. So whatever the thing I told. So first of all, we are doing the 3 days of structured high quality webinars. Individual webinar, if you come, 500 will be the charges. If you take like a 2 webinars together, 35% offer will be there. So you will get a 650 for 2 webinars. So if you take any membership program for 6 months or something, so if you attend any paid webinars, followed by that, I will open a window where you can get the 6-month webinar price of like 2000 plus, like 2500 or 600, like that it will be there. If you attend now, if you book for now, then you will get a 3500. Okay, after this free webinar. Rest of the time, if you come for the membership, it will be a 6000. So that time it won't reduce. Okay, and this 2500 I already told you, right? Followed by the any paid webinar. If you come any paid webinar, after that, if you register, you will get a 2500 only. Yeah, that's it. Thank you so much for giving me this time to read that. Now come for the systems. So how many of you know a system? Any system you know in the core? There are some system. Core muscle, not only core muscle, Any one muscle won't work alone. It will work along with some other muscles. Likewise, core muscles also work as a pattern of systems. So in that, anybody have any idea? Any idea? Anybody have anything related to the facial chain, anatomy, trains, anything? No, sir. Lumbopelvic rhythm, somebody. Lot of people gave you the review in text format. Okay. Lumbopelvic rhythm is like it is a rhythmical movement of the lumbar spine in relation with the pelvic spine, or else rhythmical movement of the pelvic spine in related with the lumbar spine to increase the range of motion and to minimize the load on the muscles which is moving the particular joint. Okay, it is equal to the scapulohumeral rhythm. So what I'm asking is this: there are some systems, some global systems are there. Okay, some group of muscle which is working together to do a functional kind of activities. Okay, so that is the question actually. Open and closed chain kinematic chain. Open and closed kinematic chain. Open kinematic chain means if you are moving any one segment without moving another segment, that is called closed kinematic, open kinematic chain. And if you are moving one segment, because of the movement of one segment, if all over the segment in the particular limb is moving, that means that is called it as closed kinematic chain. Usually how they used to call it as, if you are moving the distal segment, if the distal segment is free to move, that is open kinematic chain. If the distal segment is fixed and your proximal segment is moving, that is called closed kinematic chain. That is not related to this one. Okay, I will let you know that. Before that, what is the time now? Okay, let me finish within 5 to 10 minutes. Okay, everything got over. Yeah. So I already told you the local stabilizing system. What is meant by local stabilizing system? Especially the multifidus muscle. What is the main function of the multifidus muscle and the interspinal and intertransverse muscle? Segmental stability. That means it provides the feed forward mechanism. It will contract first, thereby the rigidity of the spine will get maintained. Thereby there is a less shear force will happen in the joint. Shear force means what? Sliding force. Okay, the intervertebral joint won't slide too much. Okay, so it will act as a rigid structure. Thereby the outer muscles, global muscles, that is the erector spinae muscle or else your latissimus dorsi muscle, can able to produce a proper function on the spine. Thereby the integrity or the congruence of the spine won't get spoiled. If the multifidus muscle is not there, what will happen? There is a more shear force will be there. So every force will go on the ligament of the this vertebra. The ligament will get laxity over the period of time. Then you will get instability. So because of the instability, you will get spondylolisthesis, and you may get spondylolysis also. That means the more pressure on the facet joint, thereby the cartilage which is present on the facet joint will get erode, and over the period of time it will get lysis and losis. Okay, it will happen. Listhesis means you already know, slippage of the one vertebra on the another vertebra, and obviously you will get intervertebral disc prolapse also. Okay, these are all the things you may get. So the muscles are small in size, but those muscles are having a high rich in muscle spindles. That is the main proprioceptors. Okay, thereby you can able to sense whatever the spine movement currently. Okay, whenever you do a small movement also, that muscle can able to sense the movement. So those are the highly having the proprioceptors, and also those muscles are the high proportion of the type 1 muscle fibers. Can anybody tell what is the type 1 muscle fiber? Fast glycolytic or slow oxidative? What is type 1? Fast glycolytic or
Slow,
slow oxidative? Yes, that's it. Okay, it can't able to produce the force very fast, but at the same time it can able to produce the force. Okay, it can able to contract before other muscle contract by means of the proprioception, but at the same time it can able to work for the long hours. That is mean by fatigue resistance muscle. Oxidative in the sense it can able to conserve the oxygen and it can able to deliver the ATP, which is the fuel for the energy production of the muscles. Okay, contraction of the muscles. Yeah. So whatever I told, that is the thing here. Now come to the local lumbar inner muscles. I already mentioned everything in detail. Now come to this point. Everything I told, right? And only one thing I didn't told. That is, you are pressing from upper side, downward side, forward side. Everything it is going to back side. What is happening to the back side? Now, imagine that you are having a stick. Okay, in the stick you need to maintain in straight position. That stick should not fall in any direction. So what you are giving, you are sealing from the sideways, you are sealing from the front ways. Okay, usually God created a curvature of the lumbar spine like front oriented. That means the lumbar curvature in nature itself, it won't fall backward. It is already fell back forward only. Because of the forward curve in nature, we won't collapse like this. Okay, by means of a kyphotic posture. If we want to passively get stable in the back, if you go and see a Duchenne muscular dystrophy patient, I don't know everybody, how many of you seen Duchenne muscular dystrophy? If you see a Duchenne muscular dystrophy, or else that is the main thing. Typically, you can see, or else you can see any poliomyelitis patient, thumb of the poliomyelitis patient, they used to have a hand on the pelvis. Okay, they used to have the hand on the pelvis, and they will do the anterior pelvic tilt on the pelvis because they don't have a proper gluteus muscle activation. The muscle will be atrophy. So they will be fully depend on the lumbar lordotic curvature. That is the, if you do the lumbar lordotic, that is the close pack portion of the lumbar vertebra. After that, you will get a passive stability from the joint itself. Got it? If you extend your knee, you extend your knee, or else you extend your elbow. After a certain angle, you can't extend your elbow. See, after beyond that, can anybody able to extend the elbow beyond this? You can't able to extend, right? So what you are getting at the end range? You are getting a passive stability. You go and do the push-ups. Okay, you just stay in the push-up starting position. You can be there for 5 minutes also. But if you bend your elbow little bit, minimum of 5 degree, you can't able to be there minimum of 30 or 1 minute also. Depends on the person to person, it may vary. That is the other thing. But still, you can't able to do. Because why? In the mid range, you are demanding the muscles to work. But at the end range, you are giving the force, whatever the demand you are giving to the joint structures. Either it is a passive locking between the bony segments, or it's a tension from the ligament, or else any passive structures like a capsules or other things. Now got it? Everybody got this point?
Yes, sir.
Yeah. Now your lumbar in the lordotic position. So thereby it can't collapse posteriorly, but it can able to collapse anteriorly, right? Excessive lordotic curve means what will happen? Lumbar, spondylo, what you will get? Lumbar, spondylo, excessive lordotic. Lumbar, spondylo, finish that word. Spondylo?
Listhesis.
Listhesis, yes. So that is the main thing, instability of the lumbar spine you may get. Now, everything is fine. What is the main function of the multifidus? You are giving the pressure from the all the direction to the lumbar spine through posterior, towards posterior. Now, main function of the lumbar multifidus, main function of the multifidus to stiffen the spine. Thereby, the spine won't go for kyphosis. It will be maintained in the lordotic against the other muscles contraction, against the load. That is the main function of the multifidus. If your multifidus is weak, what will happen? That load will be taken carry by the rectus spinae muscles, and that muscle will go for progressive overload. Because of the overload, you will get a back pain. Okay, so segmental control won't be there, and whatever do your movement you do, and segmental control won't be there properly, and you will get a more shear force, and for that the rectus spinae need to work more and more, because that muscle is not meant to work for stability, it's meant to work for mobility. You will get the overloading dysfunction. Actually, I should not supposed to deliver the pathomechanics, but if I open my mouth, start to sharing the content, I can't close it. Okay, So whatever I know, you should know. That is my principle. Whatever I know, if you are knowing more than that, I will be more happy. So grab the knowledge as much as possible. That's it. Okay, that is the main function of the core muscle. Multifidus, we already discussed. This we already discussed. Now we'll see the local global stabilizing system. So there are some system called anterior oblique system, posterior oblique system, lateral system, and posterior longitudinal system. So what are all these system? So come to anterior oblique system. This is the cross way of the system. Start from the contralateral external oblique muscle, then ipsilateral internal oblique muscle, ipsilateral adductor muscles. These muscles, if you see the action line of the muscle parallel to each other, work coordinatively and do the functions like if you are going to kick somebody or if you're going to walk. Okay, these are all the muscles will stabilize it will produce the energy to do that particular activity. It helps in the rotational activity also. Whatever you are throwing, something you are forcefully doing, right? This is the main muscle force couple which is making that movement done. Yeah, this is the action line of those muscles. You can see here, these are all perpendicular to each other. That's why this muscle opposite with this muscle will be parallel to each other. So these are all the muscles. This is internal oblique, this is external oblique. You can able to see this is like this and this is like this, X. So these are all the actions of those muscles. These are all the actions. Now what is meant by posterior oblique system? Posterior oblique system straight away opposite to the anterior oblique system. One side latissimus dorsi, and opposite side gluteus maximus, connected by means of the fascia called thoracolumbar fascia. And this is the main muscle system which is stabilizing the sacroiliac joint, okay, in position. So this is the main muscle which is helping in the load transferring from the trunk to the pelvis whenever you are walking. So if you are walking means what is the main muscle which is propelling you forward is the gluteus maximus, and how the force is carried through the trunk is through the thoracolumbar fascia to the latissimus dorsi muscle. That's it. Now this is the time to unlock the gift. So how many of you here? I will share you the link so you can get the link. I will share you the link. Just give me exactly 1 minute. I will share you. It won't take more than that. பசங்களா புரிஞ்சுதா? எத்தனை பேர் தெரபிஸ்ட், எத்தனை பேர் பிஜி ஸ்டூடெண்ட், எத்தனை பேர் ஸ்டூடெண்ட்? போர் அடிதா கிளாஸ் ஃப்ரீ எப்படின்னு சொல்லிட்டு மொக்க போட்டுட்டு இருக்கோனா? இல்லைன்னா எதனா உங்களுக்கு யூஸ்ஃபுல்லாக கற்றுக் கொடுக்குறேன்னா எதனா சொல்லாமே. நல்லா புரியுதாப்பா? மிக்க நன்றி. நிறைய பேர் கன்னியாகுமரியிலேருந்துலாம் இது பண்ணியிருந்தீங்க. 93 பேர் ரிஜிஸ்ட்ரேஷன் பண்ணியிருந்தாங்க. எத்தனை பேர் வந்திருக்காங்க? வரும்போது என்னவோ ஒரு 40 மேலே வந்தாங்க, 10 பேர் கிளம்பிட்டாங்க. பரவாயில்ல, இருந்தாலும் 32 பேர் இருக்கீங்களே. நான் இந்த லிங்கை உங்களுக்கு அனுப்பி விட்றேன். இந்த லிங்கை இப்போ நீங்கள் என்ன பண்ண போகிறீங்க அப்படின்னா, இப்போவே இந்த லிங்கை ஒரு வாட்டி டச் பண்ணுங்கள் போதும். அந்த லிங்கை நீங்கள் ஒரு வாட்டி டச் பண்ண உடனே உங்களுக்கு என்ன ஆகிடும்னா ரெக்வஸ்ட் எனக்கு வந்துடும். நான் உங்களுக்கு பார்த்துட்டு ஆக்சஸ் இன்னைக்கே போட்டு கொடுத்துருவேன். நைட்டில் இல்லை நாளைக்கு காலைல வந்துடும். ஓகேவா?
Sir, please repeat it in English also, sir.
రవణ్య మ్యామ్, నేనేం చెప్పానంటే అందరికీ అర్థమవుతుందా? సైలెంట్గా ఉన్నారు, ఫ్రీ వెబినార్
అదంతా
మంచిగా
అర్థమైంది
ఉందా?
సార్. క్లాస్ బోర్ అవుతుంది అదంతా కూడా అడిగారు. తర్వాత లింక్ గురించి ఏదో చెప్పారు కదా, అది అర్థం అవ్వలేదు సార్.
లింక్ని ఒకసారి టచ్ చేయండి. టచ్ చేస్తే మీకు యాక్సెస్, నాకు రిక్వెస్ట్ వచ్చేస్తుంది. నేను దాని నుంచి మీకు యాక్సెస్ ఇస్తాను. 2-3 సార్లు టచ్ చేస్తే ఏమవుతుందంటే నాకు ఒకే పర్సన్ నుంచి చాలా మెసేజెస్ వస్తుంది. నేను అన్నీ ఓపెన్ చేయాల్సింది. ఓకే, యూ కెన్ టచ్ ద లింక్ 1 time. I will get the message now. You can able to directly see that also. See, Aishwarya, Jayashree, everybody gave that. Okay, like this it will show to me. Yeah, see, lot of persons gave. I will give you the access. Okay, now as of now you won't get the access. By within tomorrow, I will get that. I will give you the access. Okay, so this is the offer I want to give to you. I already gave, but since whenever you are coming with this code, I am a Good Physio 20, you will get a 24% offer. Whatever the paid webinar or whatever the workshop or whatever the things I am conducting, you will get the offer. And if you are registering a spot registration by means of by now, okay, for a radiculopathy webinar, you will get a 30% discount. Okay, usually it is like 25%, I think so. Now you will get a 30%. If you are coming ahead with 2 webinar registration, you will get a 45% discount. And if you are going to get going to register for the 6-month membership, you will get a 3200. So for that, what you need to do, only one thing. If you are interested in joining the membership, you just type a capital M. Okay, membership, capital M. That's it. If you are interested in the taking a 2 webinar first, after that I will go to the membership means you can do like that. So you can just type a D, double webinars. Okay, or only radiculopathy, cervical radiculopathy means. So you can type a or I will understand. So who are putting a chat after finishing of this webinar, I will read that and I will personally contact you. That's it. That's it, Pa. So I need to survive, right? I need to do this thing commercially. Okay. Okay. Instead of that, so whatever I am going to give, that is like transparent content. That's it. You can trust me. That's why people again and again, they used to come repeatedly for my free webinars. I won't hide lot of things. I will give you lot of things. The thing is, whenever you are not paying, you won't have attention to listen. Okay, if you pay 500 or if you pay some amount, you'll have attention to learn because we gave some money, so we need to learn something. Okay, so that scenario will be there always. If you earn it, then only you can able to learn. Earn in the sense you are giving the money to this and you are doing that. Sorry for my poor English. Yeah, now come to the content. Lattice mesh dossier I already told, but a lot of the things I will open in the core webinar only. Here I can't able to tell everything because already your concentration time got over. So these are all the main thing, especially the posterior oblique chain. It is like a control. Whatever the anterior oblique chain did the job, followed by that control should be there. That is provided by the posterior oblique chain. Lateral system, any unilateral activity. You see one side quadratus lumborum with opposite side gluteus maximus, opposite side iliotibial band, along with the opposite side adductor muscles also. Okay, together work as a system. So what is the main function of that? Whenever you do any unilateral activity or unilateral weightlifting activity, okay, in walking or single leg stands, whatever you do, this is the main muscle which stabilizes your pelvis. That's it. Whenever you do running is unilateral activity or bilateral activity. Running is a unilateral activity. You can't run by two legs at the time. You can run with one leg at the time. If this lateral system is failure, you will get a imbalance and you will end up with the back pain, or you will end up with the SI joint related pain, or you end up with the knee pain, either ankle related pain issues also you will end up. So these are all the lateral system examples. Okay, farmer walk, suitcase walk, kidnapping walk, saving walk. Okay, you can tell like that also. Posterior longitudinal system. Posterior longitudinal system is like a superficial system. Whenever you do a forward bending activity or forward lifting activity, okay, these are all the muscles from the head to bottom. So if you take rectus spinae muscles along with the sacrotuberous ligament from their medial and lateral hamstring muscle from their medial and lateral gastrocnemius will work together and it will function. So whenever you are training for back pain patients, keep in your mind this. You need to train these muscles. These are all the muscles. Anterior superficial line. Okay. Start from your sternocleidomastoid. Okay. From there you come to the rectus abdominis muscle. From there you come to the what is that? Rectus femoris muscle. In that you come to the muscles of the front part of the legs. That is the tibialis anterior, extensor digitorum longus, extensor hallucis longus. Those are all the muscles. Okay. These are all the deep front chain muscles. Deep. This is not superficial. Deep. So deep neck muscles along with the psoas muscles along with the adductors. So these are all the muscles. So combined functions, I told you, right? So whenever you do sit to stand, so whatever your superficial, that is the posterior longitudinal muscle will stabilize the spine. At the same time, your anterior chain, okay, it will try to lift you from the chair. Sit to stand. So here also, your how you are lifting in the sense, stabilizing your spine, okay, and also you are driving the force through the anterior muscle, and you are lifting through the anterior muscles, and you are approximating your both legs through the adductor muscles. Running lateral system, I already told. Lateral system. So this is mainly combination of all the systems together. Everything in depth I can't tell here. These are all the little bit the idea. So I told you already in the paid webinar, I can tell whatever the things you want. And the anterior oblique system example. Any questions so far? You can ask through mouth. Some patient who contacted me, is that patient is still there? ACL injury? I don't know the name. I told the person to come to the webinar. I think he is not there. Any questions so far? You can ask me directly. Or else if you want to give any review through your orally, you can give. I'm happy to receive that. But it should be like what you learned. You need to tell. How about the webinar? You can type in the chat box also, no problem. But more than typing in the chat box, you can type in the Insta. Okay, I will share you the Insta right now. After that, you can share that. Happy Raksha Bandhan to all of you. I forgot to wish you all. Okay. So Raksha Bandhan in the sense it's not like between the brothers and sisters. It is like you can do for anybody. It's like I'm there with you. I support for you. Okay. Whatever you are facing the difficulty, I will be there with you to support you. To remember the thought only, you are doing that Rocky, whatever the things. So I believe in that. So in that manner only, I'm telling happy Raksha Bandhan to all of you. Thank you so much for giving this valuable opportunity to deliver a content to you. And thank you so much for your patiently listening my poor English with that content. Okay, I try to update my English fluency also, webinar by webinar. Don't worry for that. And is there any negative feedback also you can give to me through your personal messages or that? I will correct it for the future webinar. Is there any doubt still now? If you have, you can ask me or you can type in the chat box. I start reading that.
No doubt, sir.
No doubt. And what about the clarity? You got any idea in the core? Any confidence core about
Yes,
the
sir.
core?
Yes, sir.
Because core muscle is the one we won't read, right, in the BPT. We used to write upper limb muscle, lower limb muscles. Okay, that's it. Little bit of pelvic floor muscles. In pelvic floor muscles also, we don't have any idea about the imagination, how we need to imagine the muscles. And core muscles also, what are all the layers of the core? We don't have that much clarity. That's why I thought of, okay, taking a different topic, and that is the important topic, negligent topic, which will be useful for our students. Thank you so much for everyone. Okay, see you, bye-bye. I need to take care of my child, baby. Bye-bye, see you, good night, see you in the next webinar or upcoming webinar or free webinar. Take care of all of your health and the career,
Thank-
knowledge,
Thank you,
everything.
sir.
Okay.
You too take care, sir.
Thank you.